So she came in with nausea and vomiting. She could not keep anything down. There was no medications that were making her feel better. So in this case, something more was going on. In fact, there was an actual blockage in her gut. Howdy y'all, Dr. Islam here, aka your poop guru. When someone comes in with persistent nausea and vomiting, we need to do a deeper dive to find out exactly why, because it may not just be your typical nausea and vomiting. Something could be blocking your gut to preventing things from passing through. So in this scenario, this patient was coming to see me with persistent nausea and vomiting going on for months. Every time she ate, went to her stomach, and a few minutes later, she just vomited up, and it just would not get better. She couldn't eat. In fact, she was losing so much weight. She lost about 30 pounds before she came to see me. She had all sorts of testing done by her doctor, including blood testing, checking her gallbladder out, but nothing could explain why she was having her symptoms. All medications were tried. She was tried on acid medications, anti-nausea medications, reflux medications, but nothing seemed to improve her symptoms, and she was just wasting away. So we did the first thing, which is I just took a look with an upper endoscopy to see exactly what is going on in that stomach. So as we went down into the stomach and the small intestine, here's what I found. We found a narrowing right at the connection between the stomach and the small intestine called a stenosis. This was the reason why she was having nausea and vomiting. Food would go right into the very end of the stomach, hit this area where it was narrowed, and then reflux up and upchuck because she could not pass that food beyond that narrowing. She had a blockage. And that was exactly what was going on. So what do you do when you have a blockage? Well, you open it up, and that's exactly what we did. We performed what's called a dilation. Using specialized tools, I was able to go into the narrowing and pop that narrowing open to break the scar tissue that was causing that stenosis and stricture from occurring. Now, this allowed food to move through a lot easier so we can get past that narrowed portion. And for many patients, this can be the difference between wasting away and being able to eat. Now, there are a lot of reasons why people can have strictures. Sometimes it can be from chronic inflammation. Sometimes it could be a prior ulcer that had narrowed down. For others, it could be an active ulcer that's there. And unfortunately, it can also be due to a cancer in that area as well. And these symptoms are commonly nausea, vomiting, abdominal pain, weight loss, getting fuller quicker and more often. Now, here's the important part. These symptoms just don't go away on their own. And if something feels off, especially if it's consistent nausea or vomiting, don't ignore it. It may be a narrowing, it may be a stricture, and if that's the case, it's something that we can easily fix and get you treated right away. So if this is you, come visit us at LubbockGastro.com for more information and visit our office. We can see you today. You don't need a referral, or call us 806-696-4440. Let's get you feeling better.